acknowledge the traditional, ancestral, unceded territory of the Three Fires Confederacy of First Nations, comprised of the Ojibwe, the Ottawa, and the Potawatomi. It is the territory on which Hôtel-Dieu Grace Healthcare, the University of Windsor, and the WeSpark Health Institute sits. And as settlers, we are grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. And just a brief moment of pause for self-reflection. Welcome everyone to the inaugural Caring for the Caregiver Conference. This has been long awaited by many people here today. My name is Patrick Kolowitz. I'm the Director of Mental Health and Addictions here at Hôtel-Dieu Grace Healthcare in Windsor, Essex. One of the rewarding aspects of my role is being able to lead the Hôtel-Dieu Grace Healthcare Mental Health and Addiction Patient and Family Advisory Council. The idea for this conference originated as part of Hôtel-Dieu's Mental Health and Addiction Advisory Council. My first of two very special acknowledgements is for Clemenza Stan. Clemenza has dedicated countless hours of volunteer contribution to the council. She joined the council on May 13th, 2015. And I had to dig deep, and sorry, someone is not muted. It's giving me a little bit of feedback. If you could just—
I just muted them.
Okay, perfect. Thank you, Adriana. Clemenza joined the council on May 13th, 2015, and I had to dig deep in the hospital archives to find that. Over 2 years ago, it was Clemenza who first generated the idea to host a Caring for Caregiver Conference. At that time, we did not anticipate COVID, including its impact on the ability to have large in-person events like conferences, which was the original plan. On the other hand, the delay allowed an opportunity to further advance the idea to what it has become today, and hopefully beyond. My second special acknowledgement is to all of you as informal caregivers. You are important and special partners in the care for loved ones with mental illness and/or addictions, and we want to recognize and show our support to you as part of this event. Very special thanks to those of you who have invested your time in the research component of this experience that Dr. Cruz and Voth will review in more detail soon. The focus of this conference is on education, wellness, and connections. This is our first day of a 2-day conference. Our presenters will discuss topics including consent and the Mental Health Act, as well as an understanding to mental health and addiction. A panel of caregivers will share their experiences, and an overview of the research behind this conference will be provided. The session recordings, with the exception of the panel discussion, will be made available on the WeSpark website. Details will be emailed following the conference. This conference would not have been possible without the partnership between Hôtel-Dieu Grace Healthcare, the University of Windsor, and the WeSpark Health Institute, and our organizing committee members, Dr. Jennifer Voth, Dr. Edward Cruz, Clemenza Stan, Shirley Fields, Ryan Palazzolo, Adriana Grande, and Erica Kolovic. Thank you to all of our presenters and panelists who have volunteered their time to develop content, coordinate activities, and prepare for their respective sessions. Without further ado, I would like to welcome two influential leaders from our community to bring greetings. Claudia Denboer, CEO of the Canadian Mental Health Association, Windsor Essex County Branch, and the Executive Lead for Community Mental Health at Hôtel-Dieu Grace Healthcare, and Dr. Debbie Shepherd-Lemoyne, Dean, Faculty of Nursing, the University of Windsor. And Claudia will be up next.
Okay, thank you, Patrick, and good morning, everyone, and thank you for giving me the privilege to be part of starting your first day today. So Rosalind Carter states that there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And I thought that that was a really great way to think about the role and the focus that the conference is going to be taking over these 2 days. And I know that more and more Canadians are taking care of friends, family members, and loved ones of all ages. And certainly the impact of the pandemic on overall mental well-being has likely increased this need for caregiving. And caring for a loved one can certainly be rewarding, but I'm sure, as all of you know in spades, it can also be very tiring, overwhelming, confusing, and stressful. And so when I look at the focus of the conference, it is very clear that all the people that Patrick just mentioned have given considerable thought into identifying some key supports that will hopefully be enablers of your well-being, regardless of the role that you play in the caregiving spectrum. And although the disease might hide the person underneath, especially for those that are struggling with a mental health or substance use challenge, and it can be challenging to provide the love and attention that they need, I'm certainly hoping that the sessions on understanding the illness will be helpful and enhance the skills that you bring to the caregiver role. And I would also imagine that it's easy to feel like you have to be there for a loved one all the time, or find yourself spending more time caregiving than you would like. And in this regard, I love a quote from Audrey Hepburn: "You have two hands, one to help yourself and one to help others." And hopefully the sessions that focus on compassion fatigue, peer supports, and navigating the system will help you to think about your own needs and how best to ensure your self-care. And finally, I hope that overall the conference builds strength and courage and confidence for you all. And please know that CMHA, if CMHA can assist you in any way, we are here for you. And I did note that there are people joining this conference from across the country. And so there are other CMHA branches. We are a national organization. And please don't hesitate to reach out if we can be of any support to you. And enjoy your day. Thank you.
Thank you, Claudia, for those warm and insightful words. And over to you, Debbie.
Well, good morning, everyone. And like Claudia, I felt privileged when I was approached to give a welcome to your conference. And so on behalf of the U Windsor Faculty of Nursing, I'm joining you from the East Coast, where I had to take on some caregiving responsibilities this week with my 87-year-old mom. And so I'm in the land of Mi'kma'ki. So I just wanted to acknowledge that. And it's so great with technology to be able to join, like you're saying, Claudia, from anywhere in the world. And I really want to wish you the most caring thoughts as you share together during the conference. And as you've already mentioned, Patrick, this has been an exceptional 1.5 years. I guess we're approaching longer than that now for caregivers, as you and all of us have navigated day-to-day lives in ways none of us could have ever predicted. Like someone said to me not too long ago, Debbie, you just can't make this stuff up. And we can't. We could not have fabricated if we even tried. So I just want to share with you, globally, I'm very involved as a member of the International Family Nursing Association. It's been my passion for many years. And my focus is on family interventions and their impact on practice outcomes. And you can imagine, I've been meeting and working virtually. We've been busier than ever, you can't imagine, with nurses, academics, researchers, and students in countries that have included, and this is monthly, we meet about 3 times a month, Brazil, Spain, Portugal, Australia, New Zealand, Taiwan, Japan, the UK, Ireland, USA, and across Canada. And we have a new person just joined us this past week from Africa. Consistently, we're hearing stories of family caregivers' burden, but we're also hearing of the creative strategies that emerged in caregiving. And we're in the process now. We've been funded for a global grant, and maybe I can include you folks somehow down the road. So just stay tuned. But I think it is an exciting time. As difficult as caregiving can be, there are many rewards, and it has been a time, like Claudia has said, mental health is at the forefront, and families are at the forefront. And for those of us that have been working with families, and some of you may be included, we've often felt like the distant cousin that, oh yes, we need to think about the families. Well, now it's right in front of everyone with what's happened with COVID, with deaths in long-term care, and with the ways that we've understood what the practices are that support caregiving and support our folks. I don't know if you're aware, but as I was doing a bit of digging for today, the United Nations has noted that caregiving is essential for maintaining the social fabric and building human capital. And it is a much better indicator of society's quality of life than its gross domestic product. And I'm sure some of you around the table are very well aware of that. You and all of us that are involved in caregiving are vital to our society in defining how we are as global citizens. And we've learned the globe and the world is so small throughout these months, and caregivers are on our minds and families are on our minds. So going forward, if I can plant one seed with you, is to keep going with your excellent work. I think the time has come. We're on that point where we need to think differently and we need to create new ways of caregiving, supporting our caregivers. And I guess from our perspective within a faculty of nursing, it's ever on our minds as we build our curriculum, as we work with our students and our agencies and our folks. It needs to be right in front of us. So many thanks for including me in your welcome this morning. I'm just delighted to offer a few words and just let you know I'm there if ever you want to connect. And this is such important work that I think we need to expand even more. So thank you again and all the best.
Thanks so much, Debbie and Claudia, for those words. And I know looking at the registration details this morning, about 75% or so of the people who registered for this conference are local within Windsor, Essex, but the remaining 25% are, all across Ontario, some of the Western provinces, all the way out to someone registered from New Zealand. So it's really our first international conference, Caring for the Caregivers. So definitely lots of interest. We know this is such a significant need. We know that caregivers play such an important role in people living with mental health and or substance use concerns. So thanks again. I would now like to